Hi, I'm Tonya, and this is Nurses Speak. I made this video after watching a video on Registered Nurse RN. And the title of that video is Worst Parts of Nursing, What I Dislike About Being a Nurse. And what she mentioned in the video were three things that had me taking some deep reflection on. First thing she said was, you can't save everyone. While I agree with that, and there definitely are some patients that will not survive their condition, the one person you can save is yourself. You owe it to yourself and your loved ones to save yourself. Secondly, she said, you see the ugly side of life. Young children dying, families stricken by grief. But there's an ugly side to nursing as well. And I'm hoping that we'll begin to lift the veil on what some of those things are. Because there's a lot involved in nursing that the average person wouldn't see or experience or even know about. And thirdly, the expectations can be overwhelming. Yes, they can, especially when those expectations go beyond what's feasible or humanly possible. Couple that with the mindset that you're the nurse, you're supposed to get it all done, figure something out, with no additional support. I'm sure many of you know exactly what I'm talking about. When attacks are coming at you from all sides. You know, yesterday I read an article of a study that was published by the American Nurses Association. And the title of that article was 34% of nurses report poor mental health. It was over 9,000 nurses across the nation were surveyed. And let me tell you some of what they found. 75% of nurses reported stress over the past 2 weeks. 68% reported frustration. And 67% said they were exhausted. 34% said they were not emotionally healthy. Another 31% reported neutral emotional health. And only 35% reported good emotional health. That's a significant red flag. Because I'm definitely concerned about the 34% that identified as not being emotionally healthy. But of particular concern is the 31% that reported neutral emotional health. Because what I see as neutral emotional health translates into, I'm just here. I'm numb. I don't feel good or bad. I don't feel anything. So if I was going to break that down, I would see that as 65% are not emotionally well to some degree. And that is a staggering figure. Only 35% of nurses said they felt their organizations really cared about their well-being. That didn't surprise me either. The data's out there. There's something going on. In fact, the COVID pandemic didn't really create these situations. It just brought it to the surface. it brought it to the forefront and made it a public issue. So when we look at public health, are we also looking at the health of those in healthcare provider roles? Nurses have been called the backbone of healthcare since I became a nurse decades ago. But as any good nurse can tell you, you're only as good as your back is. And once that back goes out, then what? Then what? I want to hear from you, though. I would like you to put your comments in the chat. Let me hear your story. Let me hear your thoughts and feelings on that. Because this is a channel for nurses, where nurses speak. This space is safe, and no topic is off limits. Our next video will be focusing on some of the things you can do to save yourself, because you are worth it. Your voice matters. Until next time, thank you for watching. Like, subscribe, share, and remember to turn on your notifications. You don't want to miss our next episode. Thank you.